Welcome back. As I mentioned, we have Dr. Cheng-Han Chen here on behalf of MemorialCare. Well, welcome. It's nice to see you again. It's been a while.
Yes, thank you for having me back. It's been about 3 years since I was
About
last
3 years. Well, like you had mentioned off camera, we did a Zoom, and so thank goodness for Zoom. But nevertheless, welcome back. And before we get started to talk a little bit about what you're doing with MemorialCare, tell me about yourself.
Okay, well, so I am an interventional cardiologist specializing in what we call structural heart disease. And so I do a lot of procedures for heart disease. And I've been with MemorialCare Saddleback Medical Center for about 5 years now.
Okay, okay, so it's been a while. Now, do you operate, where is the structural heart program located? Is it right down the way here?
It's right in the first floor of the hospital is where we do a lot of most of our procedures.
Okay, great. Now, in your background, which is wonderful to help you today, is you speak fluent Chinese Mandarin.
Right, yeah. There are a lot of your viewers and a lot of the residents here in Laguna Woods. There are a lot of Asian residents and specifically Chinese residents. And I always tell people the doctor-patient relationship is like a partnership, and of course, being able to communicate in their native language really helps the partnership a lot. So yes, I speak fluent Mandarin Chinese.
Oh, that is helpful for sure. I agree with that. So you're the medical director of the Structural Heart Program, and tell me a little bit about some of the latest updates that's been happening.
Right, so we're very excited to have just passed last week our 5-year anniversary of the beginning of the program. So we started with our very first TAVR procedure in December of 2017. And since then, the program has basically exploded. Just about 2 months ago, we just passed our 500th case, our 500th structural heart procedure.
Wow.
So that was a really big milestone for us.
What kind of procedures are you doing now that are the most common?
Yeah, so we started with the TAVR procedure, which I came to talk about a few years ago. It is for a condition that's very common, as you get called aortic valve stenosis, in which one of the heart valves, I tell people it's the most important heart valve in the heart, the aortic valve. It's like a door that slowly gets more rusty as you get older. And in the old days, the only option was to have open heart surgery, which was a big deal, especially in older patients. And so about 10 years ago, there was a new technique that was invented where we can do a minimally invasive valve replacement simply through a small incision in the groin, being able to put in a brand new heart valve, and patients basically recovered in a couple of hours. They can go home the next day. Right, the TAVR procedure. So now that's become very commonplace here in the United States. We started it here in Laguna Woods at Saddleback Medical Center in 2017 in December, just like I mentioned. That's how we started the program. Then we had another procedure called the Watchman procedure. Now that's also becoming very popular. A lot of your viewers will know about this condition called atrial fibrillation. It's an irregular heartbeat that gets very common as you get older.
Right.
One of the problems with atrial fibrillation is that it has a tendency to cause strokes in people. And so because of that, we recommend blood thinners. Now,
prior to doing any surgery?
Correct.
Okay.
Yes, so the first line of treatment is to give people blood thinners. Many times, a blood thinner is not a great idea for a lot of older folks, folks who are prone to bleeding, folks who are prone to falling.
Sure.
So in these patients, we say, well, maybe it's not the best idea for you to be on blood thinners long term. And there is a procedure that was developed called the Watchman procedure. It is where, again, we can do minimally invasive technique to go up to a small incision in the groin, go up to the heart and put in actually a very small plug. It looks like a little plug. It goes into the part of the heart that is prone to form clots. And with this technique, we can actually prevent strokes just as well as if we were giving someone a blood thinner without the risk of a blood thinner.
So, talk to me about the first one. What do you call it? TAVR?
The TAVR, T-A-V-R, yeah.
TAVR. So how does that particular valve close?
So the way that the valve works, it's basically a bioprosthetic replacement. And so we're putting in a replacement valve right over the old valve. So we just push the old valve out of the way, almost like putting a new door in with the door frame and a new door. And so once we're able to push the old rusty door out of the way, the new door will start working perfectly, opening and closing, just like new.
So you leave the old one
That's
in
right.
there. Okay.
We just push it out. In fact, the calcium from the old valve that was causing the problem, we actually take advantage of the calcium, and it's almost like the anchor for the new valve. So we actually take advantage of the calcium to hold the new valve in place.
Wow, that is insane. That's really amazing that you're able to sort of repurpose what is causing the problem to begin with.
That's right. Yeah.
And then the buildup of calcium, is that just something like, I know you mentioned age, but is there something that we're eating or doing that can also contribute to that?
Yes, that's a very common question I get. The short answer is there is nothing we can do to prevent the development of this condition. So it's not diet. Even though in much of what we do in heart disease, we talk about diet, exercise, medicines, none of those make a difference for the development of this condition.
It just is what it is.
That's right.
All
Normal
right.
aging.
How should they, how would you know if you have it? I mean, would you have something done with your doctor first?
Right. So there are a lot of ways that people find out that they have this condition called aortic stenosis. One common way is that they start developing symptoms, and the symptoms of this condition are most commonly fatigue, shortness of breath, especially with activities, sometimes lightheadedness and dizziness, sometimes chest pain. And so when they develop these symptoms, they go see either the regular doctor or a cardiologist, and we do some tests, and we find out, oh, you actually have this condition. The most common test that we can use to find this is an ultrasound of the heart called an echocardiogram.
Oh, echo, okay.
Sometimes we find this condition simply through a normal physical examination. So a patient will be going to their regular doctor for a routine checkup, and just simply by listening to the heart, the doctor can hear what is called a murmur. You may have heard that term, a murmur. And so people know that they've been told they've had a murmur. And frequently when we do the testing, such as the echocardiogram, to study why someone has a murmur, we find that condition, the aortic stenosis.
So what's the difference between using that particular discovery as opposed to an EKG?
Right. They look at two different things. So the EKG is, you may have seen the paper with the lines. That's an electrical pattern that we get from the electrical system in the heart. And that's good for looking at a lot of different things, but in particular, we use that to look at electrical system disorders in the heart, and sometimes we use it to figure out why someone would be having chest pain. It's less useful for looking at heart valve problems, structural heart problems. For that, we like to use the echocardiogram. It's the most helpful.
I like the way you guys say that. One part is electrical and the other part is plumbing.
That's right. Right. So I'm a plumber.
You're the plumber.
Yes. That's right.
Well, thank you so much for the information. I really appreciate it, and happy holidays to you.
Thank you. Happy holidays to you too.
If you want more information about what we have just discussed or have any questions regarding the program over there at MemorialCare, you can always go to their website, which is memorialcare.org/MHVI. We'll be right back.